I've been amazed at how much the community cares about what NMC brings.
Fundamentally, it's about our people and our community. It's about our staff, our volunteers, our medical staff, and the people that entrust their care to us in Franklin and Grand Isle counties.
It's creating that relationship with our community. You can hear it in the feedback that we get from patients about the quality of care that they get here.
I'm absolutely extremely passionate about this hospital and this community and having a vision of wellness. What's most important, it isn't my vision. I get the staff involved, I get the medical staff involved, I get the community involved, and what do you think is important? And then how do we bring that together for a collective vision?
I think there's a really strong support for this institution and the staff, the leadership, the healthcare providers that feels unique.
When you see the big blue H on the road signs, it typically stands for a hospital. We want it to stand for the center of health, that this campus is a catalyst to wellness and prevention.
It's a small community, and we keep track of each other. I still see people on the street from both places. Just the other day, somebody said, "Kathleen, you helped deliver this baby, and here's my granddaughter. This is she." Does that make you feel old? But people remember you.
The history of this hospital is very fascinating when you think about how it got started, how the second hospital location got built, and really built with money of passion and gratitude.
I think we've all shared that commitment to local health care, that this community will always be cared for. We're part of the community fabric, and I think we'll always need health care. It will evolve and change, but we've been here since 1883. As St. Albans came together as the population center in Franklin County, Chauncey Warner bequeathed assets to the community to create the first St. Albans Hospital. In 1947, you've got Jeannie Curbs. Local physicians saved her son.
When her son was shot down at Camp Killcare, she was extremely grateful for the services of Dr. Semple, who basically saved his life, and so she wanted to do the right thing.
And Curbs Hospital was born. In one of the interesting twists of history, the St. Albans Hospital stayed.
And along with the separation of the physical facilities, you had a political split in not only the city of St. Albans, but in Franklin County.
It was inevitable that there should be a union.
It's fair to say common sense eventually prevailed.
As a community, it ended up really healing a lot of wounds. And instead of having something that was weak and divided, you have something that's unified and powerful.
Fast forwarding to today, those partnerships continue to be nurtured. When you think about healthcare reform and how the environment for healthcare is changing, we need to come together.
When I go around the state, people look at Northwestern as a major hospital and a leader. Northwestern has really established itself as a premier hospital.
When you think of the NMC campus as being somewhat of a hub in our community, there's a lot of spokes that go out that are really, really important.
It's been a long association with the hospital. NMC does the credentialing for new hires for us. We send our bloods to the lab here. The ER has access to our medical records. Actually, we've compiled a list 4 pages long of the things that we do together.
We're very fortunate to have a small community hospital here. There's a different experience in that hospital. People going out of their way.
It doesn't matter what part of the organization you belong to, everybody's an equal part.
Walking through the front door and being greeted by a concierge and everyone you meet in the hallway that smiles and says hi to you really makes a difference.
This is an organization that is nimble, it's friendly, it's forward-thinking, and it is a gem in this community.
What makes me smile at the end of the day is the incredible team that I'm working with. They believe in the mission of this organization, and they take great pride to bring it alive every single day.